So, you know, this Act actually raises more questions than it answers, because what I've written on the first version of the bill I got is, which principle receives priority? Well, the answer is none of them. Which preamble is most and least important? You don't get anything out of that either, because the preamble is not enforceable. And how is any conflict resolved in between any of these things? And none of those questions are answered in this. The complaints process, you know, doesn't talks about if a complaint is frivolous or vexatious or is without merit. My notes say, well, what is the test? Is there an appeal process in place? How does this work? Nothing. There's nothing that indicates that there would be an appeal process, or that the test or the criteria that would be used to say that a complaint is frivolous or vexatious. So when you look at other acts where that's defined, it's clearly defined. So you want to look in the Chief Privacy Commissioner, boy, vexatious and frivolous is defined. So everybody knows what they're talking about. It's got like repeated and, you know, all that kind of language in it. So here we had things that I think a lot of people had hopes about, and it's not going to be resolved by what's put forward in this Act. So we're all getting mail on this, I know, and I certainly am. And again, what people, and I've been through the grandmother of Bill 11, which I think was Bill 39, and I think that was in 1999. Not possible? Yeah. And then I was through Bill 11, and I've been through the Third Way and Aon, and I've been through all these different tries at different health prescriptions by this government. And always what people say is, don't privatize the system and make it work. And there's a lot of leeway in there for government to do stuff. Some of the specifics that have been brought forward by people are, where does seniors fit into this plan? Where does access to ER fit into this plan? And I know that they're asking really specific and current issues about a piece of legislation which is in effect well, clearly this one is a guideline, but it's supposed to give you a roadmap of how it would all be implemented. And there's nothing you can grab onto here. This is a cloud. So, you know, my motion, which my colleague kindly brought forward for me on my behalf, was to hoist the bill, because it's not doing what it should be doing, and more than that, I think it will make people believe that there is a commitment from the government that is in fact not there. And I find that particularly devious. So we'll have an Alberta Health Act that doesn't do anything. It's completely a cloud, and there's nothing enforceable about it, and it doesn't answer any of the questions that people had about how to make the healthcare system better. And every day there's something else in the paper about what's going on in our healthcare system. And, you know, I was a critic for the official opposition for healthcare for 4 years. So by the end of that, I had a pretty good handle on what was happening in the healthcare system. And I'm 3 years past that now, so I wouldn't claim to have immediate knowledge of stuff. But I'm tired of the chaos. As a citizen, I'm tired of opening up that paper and watching the minister point his finger at the administrator for Alberta Health Services, and the next day you open the paper and the executive from Alberta Health Services is pointing their finger back at the minister. It just isn't helpful. And there's a lot of chaos that goes with it. And that's one of the things that I am most disturbed by, is that lack of stability and consistency in the system. So when I look at Bill 17 and I go, will those questions get answered for me? No, they won't get answered for me. Will this create stability and consistency in the system? No. Will this answer the questions we all have about who's the boss, Alberta Health Services or the minister? No. And frankly, you know, I, more than most people in here, I suspect, understand how quickly this can all turn around again. All we need is another change in a health minister, and then there'll be another year of, just wait, I'm getting on top of this. You know, the current guy likes to go out and meet with people and tell us how many meetings he's held. Previous guy just said, do it, and turned the system on its ear. The one before that, I'm sorry, I'm trying to remember who the one before that was. I've been through like half a dozen health ministers and like 11 deputy ministers, I think, in about 12 years. So the person that actually runs the system has changed over and over and over and over again. And some of the people that I talked to, they said, I don't know what form I'm supposed to fill out anymore and who it goes to, and you know, and we're all supposed to be tracking all of this stuff in the health system so we can get better. But people are spending so much time trying to figure out the new system that in some cases they're really pressed to actually get the work done. And these people went in to health service to help people, to deliver health services. So, delivery of health service. My colleagues in the wild rose, third party, fourth party, yeah, who's counting? I remember listening to their part of this debate the other day, and they were very insistent that nothing in the Canada Health Act talks about a public delivery system. It talks about a single payer. It talks about publicly administered, but nothing says publicly delivered. And I understand where the impetus comes from to look at having a mixed delivery system. But I got to tell you, if we're going to compare apples and oranges, let's compare apples and oranges. But having people stand up and tell me that the system well, actually, we just watched it today because the health minister got up and said, don't tell me that the French system is better because the French system is in trouble because, and then he named something. And that's indeed what I started to figure out, is that every system is just different enough. It's very difficult to make comparisons across. What we can do is make some very general statements about is the system delivered by a mixed system?